During the COVID pandemic, the pharmacy team here at Mount Sinai was absolutely outstanding.
We were flooded with so many questions, and our patients were worried about, should I stop my medications? What am I supposed to do when I get sick?
The response to this pandemic by the pharmacy department play an integral part of the healthcare system fight against this deadly virus. Our clinical staff work with other healthcare specialists to create algorithms that would conserve drug supply, PPE, and protocols, and produce and manufacture thousands of drugs throughout this pandemic.
A lot of the medications prescribed here are more complex logistically and pharmacologically than just taking one tablet a day. We talk about dosing, administration, benefits, risks of starting the medication.
Pharmacists are often problem solvers. We make sure that each patient has therapy that is individualized and safe for them, both during the pandemic and outside of it. In writing the treatment guidelines, we determined that it would be best if we could actually have the dosing once daily rather than twice daily. This would help with decreasing PPE use and also for our nurses to not have to go into the patient's rooms as many times.
Thanks to all these efforts, we were able to preserve the supply of essential medications and use them for patients who need them the most.
We're very fortunate to have a research pharmacy here at Mount Sinai Hospital. Now patients benefited from having the ability to be enrolled in research trials.
What we have been seeing in our pediatric patients recently is multi-system inflammation syndrome, and we're seeing this after patients we believe have had infection with COVID-19. We've been working with the physicians and nurses to create protocols on how to manage these patients, utilizing medications in patients presenting with shock.
We had to work extra diligently with all the other service lines across the hospital and the health system as a whole to make sure that we were one cohesive group taking care of our patients.
We worked with the leadership of the anesthesia department, and we created a special intubation kit for the two teams that were going around the hospitals and putting patients on ventilators.
It was great to help produce a product that not only we can use in the hospital, but families can potentially make this at home. And it really, I think, demonstrates how pharmacists can have an impact.
We have a huge team here to make sure that our patients get the best possible care.
The pharmacy department has greatly contributed to the hospital's efforts in the global pandemic.
During COVID, pharmacists ensured patients have the most accurate and up-to-date information. They are reinforcing messages of prevention and risk reduction through patient education.
I feel that this pandemic has made us stronger as a pharmacy team, along with all the departments that we work with.
We are dedicated professionals with a high regard for Mount Sinai's mission and values.